Welcome back to Guidance Videos. Today's topic of discussion is the cavernous sinus. But before coming to the topic, let us discuss about some important terms that should be remembered before dealing with the anatomy of head and neck region. So, let us first talk about the different anatomical planes or sections. There are mainly three anatomical planes or sections on the basis of which we study the internal structure of an organ or a body part. The first one is the mid-sagittal plane. As you can see in the picture, it divides the body symmetrically into right and left parts. The second one is the coronal plane that divides the body into front and back parts. And the third plane is the transverse plane that divides the body into top and bottom portions. Now, the next set of terms that you should always remember while dealing with anatomy of head are the cranial nerves. There are in total 12 cranial nerves in a human body. They are as follows. So, the cavernous sinus is a large venous space and it is situated on both the sides of the body of the sphenoid bone. As you people know, the sphenoid bone is a bat-shaped bone present in the middle cranial fossa. So, as you can see in the picture, this is the sagittal section of skull where this area marks the anterior cranial fossa and this area is the posterior cranial fossa, and here is the middle cranial fossa where the sphenoid bone is situated. So, as said earlier, this sinus is involved in the venous drainage of bone. The sinus also facilitates the passage of many structures like numerous vessels and cranial nerves. But why is it called cavernous? The sinus is so called because the entire space is divided into small caverns by trabeculae. Coming to the boundaries of the sinus, the floor of the sinus is formed by the endosteal layer of dura mater. The lateral wall, the medial wall, and the roof is made by the meningeal layer of dura mater. Medially, roof is continuous with the diaphragm sellae. You people would be knowing that diaphragm sellae is a piece of dura mater with a circular hole for allowing the passage of the stalk of pituitary gland. Posteriorly, roof has a triangular depression between the attached margin of tentorium cerebelli to posterior clinoid process and ridge raised by the free margin of tentorium cerebelli as it extends forward so as to attach to anterior clinoid process. So this is a picture showing the posteriormost portion of the sphenoid bone. Okay, and this depicts the posterior clinoid process and this is the anterior clinoid process. Okay, this is the anterior clinoid process and this is the posterior clinoid process, and it is present on both sides of the sphenoid. And this blue color thing, it depicts the tentorium cerebelli. Okay, what is tentorium cerebelli? In this picture, if this is the sagittal section of the brain, this red color layer represents the tentorium cerebelli. So, as you can see here, this tentorium cerebelli is a layer of dura mater that separates the cerebelli from the occipital lobe. Okay, that is why it is called tentorium cerebelli. So, here this is the tentorium cerebelli. This depicts the tentorium cerebelli, and as you can see here, it attaches to the posterior clinoid process and it moves forward so that it can get attached to the anterior clinoid process. and where it attaches to the posterior clinoid process, it forms an attached margin, and as it moves forward, it forms a ridge or it forms a free margin. And here is the triangular depression that is formed by this dura mater. Now, this triangular depression, as said earlier, is the continuation, posterior continuation of the roof of the cavernous sinus, which is present here on the sides of the sphenoid bone, on either sides of the sphenoid bone. So, this triangular depression is the posterior continuation of the roof of cavernous sinus, and it is through this triangular depression of the dura mater that many nerves pierces into the cavernous sinus. Coming to the extent of the sinus, both the sinus on each side extends anteriorly up to the medial end of superior orbital fissure and posteriorly up to the petrous temporal bone apex. So anteriorly the sinus extends up to the medial end of superior orbital fissure and posteriorly up to the apex of the petrous temporal bone. Now let us discuss about the various relations of the cavernous sinus. The cavernous sinus has superior, inferior, medial, lateral, anterior and posterior relations as usual. The superior relations are optic chiasma, optic tract, internal carotid artery and anterior perforated substance. The inferior relations include foramen lacerum and the junction of the body and greater wing of sphenoid. The medial relations are pituitary gland and sphenoid air sinus. The lateral relations are temporal lobe of the cerebral hemisphere and cavum trigeminale containing the trigeminal ganglion. The anterior relations include superior orbital fissure and also the apex of the orbit. The posterior relations are crus cerebri of midbrain and also the apex of the petrous temporal bone. Now coming to the structures in the cavernous sinus. The structures inside the cavernous sinus can be present in the lateral wall of the sinus, or it can be the structures passing through the cavernous sinus. First, let us discuss about the structures present in the lateral wall of the sinus. It includes 4 nerves, that is oculomotor nerve, trochlear nerve, ophthalmic nerve and maxillary nerve. Now coming to the structures passing through the cavernous sinus, there are 2. The first one is the internal carotid artery and the second one is the abducens nerve. So these are the structures present in the cavernous sinus, and the mnemonic to remember these structures are O, Tom, Cat, which is a famous mnemonic. The first 4 letters O, Tom represent the structures present in the lateral wall of the sinus. They are oculomotor nerve, trochlear nerve, ophthalmic nerve and maxillary nerve. As you all know, ophthalmic nerve and maxillary nerve are the first and second branches of the trigeminal nerve. Now, the letters in the mnemonic CAT represents the internal carotid artery and abducens nerve. This is all about the structures in the cavernous sinus. Now, let us discuss about the tributaries of the cavernous sinus. The cavernous sinus receives blood from 3 sources. They are the orbit, the meninges and the brain. Hence, its tributaries come from these sources. Now let us see which are these tributaries. From the orbit, superior ophthalmic vein, inferior ophthalmic vein and central vein of retina are the tributaries. The tributaries from meninges include sphenoparietal sinus and the anterior trunk of the middle meningeal vein. Tributaries from brain are superficial middle cerebral vein and inferior cerebral vein. The last topic that comes under the anatomy of cavernous sinus are its communications. As it is a bit difficult to remember all the communications, let us study a few. The first communication is with the transverse sinus via superior petrosal sinus. The next communication of the cavernous sinus is with the internal jugular vein via inferior petrosal sinus. The communication with the opposite cavernous sinus are via anterior and posterior intercavernous sinuses. Let us wind up this topic by discussing some clinical correlation of the cavernous sinus. The main clinical conditions associated with cavernous sinuses are cavernous sinus thrombosis and arteriovenous communication. First, let us check up what is cavernous sinus thrombosis. The septic thrombosis of cavernous sinus may be caused by its numerous communications. The commonest cause of thrombosis is the passage of septic emboli from the dangerous area of face through facial vein, deep facial vein, into the pterygoid venous plexus and to the emissary vein. Cavernous sinus thrombosis give rise to the following signs and symptoms. Severe pain in the eye and forehead due to the involvement of the ophthalmic nerve. Ophthalmoplegia, that is paralysis of ocular muscles due to the involvement of the 3rd, 4th and 6th cranial nerves. There will be marked edema of eyelids with exophthalmos due to congestion of orbital veins following obstruction of ophthalmic veins. The next clinical condition is the arteriovenous communication. If the internal carotid artery is ruptured in the fracture base of the skull, an arteriovenous communication or fistula is established between the artery and the cavernous sinus. Consequently, arterial blood rushes into the cavernous sinus, enlarging it and forcing blood into the connecting veins. Arteriovenous communication gives rise to the following signs and symptoms. Pulsating exophthalmos, loud bruit is easily heard over the eye, ophthalmoplegia due to involvement of 3rd, 4th and 6th cranial nerve, and marked orbital and conjunctival edema due to raised venous pressure in the cavernous sinus. So this was in brief about the anatomical aspects of cavernous sinus. Hope you all understood the concepts very well. Let us meet soon in the next video.
Follow us on our YouTube channel Guidance PSMDC and our Instagram page Guidance.